Page 18. Yes, Senator Nielsen, I'm sorry.
On that point.
Yes.
Analysts, or maybe finance, since 2011, counties have gotten, my data says, $650 million in growth revenue above the base revenue, okay? And we've just talked about the flexibility that they've been given. And what's gone wrong? That's a lot of money that we haven't accomplished anything with. $650 million above the base.
If you're talking about the support services account and realignment, yes. So 15-16 is expected to be $3.3 billion. That includes both the protective services and the behavioral health subaccount. So for just the protective services, $2.1 billion. That's over $1.8 billion in 13-14. I guess I didn't, maybe you could rephrase your question.
Well, the point is
there has been
an
growth.
awful lot of money to address a problem that hasn't been addressed. And aren't we doing something wrong here?
Well, I think that additional monies for the child welfare system have been invested in many very positive things at the county level. The congregate care reform is really a revisioning of the use of group homes and really trying to reduce significantly and nearly eliminate the use of group homes as a permanent placement for young people in the foster care system. I wouldn't say that the system is currently failed. I would say this is an effort to really reform the system, and many of the things in place are still, even though during realignment the counties were given a lot of authority and flexibility in some ways, especially those counties that are in the Title IV waiver, more flexibility for how they run their child welfare systems. There's still significant state and federal laws and rules on the books and conditions that the counties have to implement as a requirement of getting the federal funds. This effort is really to do more to really push on moving youth out of the group homes. There's a lot of research that creating permanency for every child that's in the foster care system is very important. And the group homes are just not the model that the research supports as providing that permanency that every youth that ends up in the foster care system should have. So that's really the underpinnings behind our effort to change the system in this area. And that includes a lot of changes to payments, reforms, and other things that will allow the system to change over time. And really the building up of that foster home group of providers.
And to expand that universe of people who will provide those foster homes, and I know a lot of those families who do provide the homes, what is our progress towards increasing these foster home opportunities? Have we made any progress? Are the numbers increasing?
Well, that's part of our budget proposal, is to provide $3.8 million to help to do more recruitment and retention of foster families. The Assembly added an additional $25 million in that area as well.
All right. Thank you.
Thank you, Senator. To be left open. Moving on to community care licensing in the Department of Social Services.
This is a follow-up. We talked about the Department of Public Health proposal related to licensing and inspections, and this is really another component of our effort to really rebuild the core state function of licensing and certification. Our proposal was a multi-year plan to improve the community care licensing division at the Department of Social Services, and includes $2.9 million in the budget year to increase the frequency of inspections to at least once to annual inspections for all adult and senior care facilities, and biannual for all children's residential facilities, and tri-annual for child care facilities. So these additional resources will go towards hiring additional staffing that will be able to maintain this level of inspection going forward. And in terms of the trailer bill adopted by the Senate, we are happy to report. I don't know that we need the specific trailer bill language. However, we were happy to review and better understand what is being requested, but we are also happy to report back at budget hearings about how all of this is being implemented.
And do you have any comments with regard to the Senate's trailer bill language, which is the difference between the houses?
Yeah, that was what I was just speaking to. I think that we would not support the trailer bill language, but we're happy to work with the staff and review the trailer bill language. We just don't think it's necessary. We can report back at subcommittees next year about how things are going. So I think it's just another report that we weren't sure was necessary, but we are happy to report on the information.
And the $2.9 million in your proposal, that's not actually going to get us to these rates of inspection. That's going to cost much more.
Jacob Poor with the Department of Finance. That's correct. This is a first year sort of ramp up. I don't have the numbers with me, but I believe you're looking at, with full ramp up, probably another $2 million. LAO may have the number, so I'll defer to that.
Really, that little? I thought it was going to be significantly more.
So ongoing staffing costs are $14 million.
14 million.
So yes, this is a multi-year effort. There was some significant groundwork and kind of building of base staff competencies and management structures that the department has been hard at work starting last year into this year. And so these are incremental resources to build upon the work that was done over the last year. And slowly really not only increase the quantity of these inspections, but also make sure that the quality is very good. Because this is a really important core function that the state does. Many of these facilities, there are very few people that are in and out of these facilities, so especially the residential care facilities for the elderly. So this is a program, a redesign that we've worked a lot on and want to continue to build and implement over the next several years.
So when we're talking about licensing under the Department of Social Services, not only are we talking about residential care facilities for the elderly, but also group homes?
Group homes,
child care
as well as
facilities?
child care facilities.
Right.
And so the way we landed on the policy to go to annual inspections for those residential care facilities for the elderly is really looking at who is in and out of those facilities on a daily basis. At a child care facility, parents are in and out of those facilities twice a day. At group homes, there are many other social workers and mental health professionals that are often in and out of those facilities on a very regular basis. But the residential care facilities for the elderly, there isn't really a lot of opportunity for other government officials to go into those facilities. So that was really the policy design.
And currently, we're not even doing one every 5 years, are we?
The budget cuts during the recession were very difficult on all areas of government, including these core functions. And so that is something that we have not been maintaining. We've been trying to move towards the every 5-year metric, and then with these resources and the redesign of the program, moving towards that annual metric is an important core goal of this policy.
At the residential care facility for the elderly, we've seen some real tragedies. I think there's some deaths in San Diego.
Mr. Chairman, when you're
Yes,
done, may I?
and as well as a home or two in the East Bay of the Bay Area where operators just left and residents were left there by themselves at the good graces of some janitorial service workers who cared for them for a number of days. Assemblywoman Melendez.
Thank you, Mr. Chairman. Ms. Bosner, I'm just curious, prior to the cuts during the recession, were we up to standard with respect to inspections?
So prior to the recession and when these reductions were made, facilities at one point were, I think, required to be inspected every 3 years. And that was across the board, I believe. As the, when the reductions were made, they were, I think at one point, went to every 4 years, but then it landed every 5 years, and that's where it's been for the past several years.
Okay, so, and I appreciate that. I guess what I'm getting at is I'm trying to understand if prior to those cuts were the standards that were in place, so it was every 3 years, I believe.
Yes.
Were we able to meet those standards? Because if we weren't, if this is a systemic problem that we've had for a very long time, then I just think a deeper conversation needs to be had about how we employ these methods to make sure that it gets done, that our money is being spent on what it's supposed to accomplish, right? Does that make sense?
Yes, we will get back to you on the prior to the recession cuts because I don't have that information with me. But I will say that there's been a lot of thought by the Director of Social Services into the design of this, what we are calling a rebuilding of the program. And it includes, many staffing issues that they've been hard at work internally doing, and also just having very good protocols about what you do when you get a complaint, and so that issues are being addressed consistently across the state, and it's not just dependent on a regional inspector.
Okay, we're going to move on to page 19, which deals with SSP COLAs.
Thank you,
Sally,
Mr.
you going to take it from there?
I will. I have a handout if you're
Yes,
interested.
please, I know you have one.
So as you can see, the Assembly provided a one-time COLA to the SSP portion of the combined SSI-SSP grant that would be effective January 1st, 2016. The cost in the budget year is estimated to be $33 million, and that annualizes to about $66 million on an ongoing basis. As the handout shows you, it walks you through sort of what would happen to the maximum SSI-SSP grant under the Assembly's action. And you can see that the grant for individuals would increase by $4, while the grant for couples would increase by $10. One thing to note here is that both for couples and for individuals, currently the SSP portion of the grant is at the minimum level allowable by federal law. And going below that would actually mean we sacrifice all of our Medicaid funding. So that's sort of where we're at now. The last state-funded COLA for the SSI-SSP grant was in April of 2005. Similar to the CalWORKs COLA item you discussed earlier, the automatic COLAs or the statutory COLA were eliminated in 2009.
Sorry, could you repeat your comment with regard to how close we are to losing our federal match?
We're not close to losing our federal match, but if we were to drop our SSI-SSP grants lower than they are now, then that would risk the federal Medicaid funding, which is why we don't do it.
But we're right at
We're at the federal minimum.
Right, thank you. Clearly another great need. I hope someone's keeping a list of the great needs and how we're at the bottom of the barrel, because we still have this debate among ourselves as to whether we have a spending problem or a revenue problem, but clearly we're barely keeping our heads above water right now. We're at risk of losing federal funding in any number of areas. We continue to bump into revenue problems. This is not profligate democratic spending. This is just making sure that aged, blind, and disabled people dependent upon the state aren't living in deep poverty, and that we, the state, don't lose our federal match because we're doing so very little for them. So that's just a side editorial comment. You want to add anything?
Well, we heard a number of proposals on our side of the house concerning SSI and SSP, and I think the finance persons are aware of it. And, desire to really bring this population up out of poverty was a huge bill. We recognize that. And so we're looking at various ways in which we can enhance the life of those who are SSI and SSP recipients. Yeah, we have a real issue of not falling too far below in terms of our SSP grant that's there. The amount of money we're giving is very small. What is $4 for one group and $12 for another, or $9, I think it is, $10. So that's a small amount of money that we're giving to our elderly and disabled in terms of those on SSI, SSP, who probably have this as their only source of income. We had a lot of folks come in our office talking about the small grants, people getting $700, $800 a month. Their rent is $700, you know, and by the time they talk to you after a couple of seconds, there's no more money left. And they start telling you, enumerating the cost of living and buying food and trying to do a transportation pass and a host of other things. So it's really unfortunate. This little bit that we put in this time is almost embarrassing to put in because it's $4, you know, and yet we have this population that's really at a point of being below the poverty level in this state. So I'm not sure what we can do, but you know, most of those on our side of the house believe we have to develop a plan of something in the state, whether it's dealing with housing subsidies and a host of other things, to basically make sure that our elderly are not, you know, on the news again with being malnourished and a host of other things that sometimes happen as a result of not getting adequate support. So we'll see how this goes. We'll hold it over, but it is an item that we heard and was very, many of our members were very passionately affected by what we heard, and our inability to address the issue is somewhat daunting in terms of our own thinking. Yeah. Okay.
Thank you, Assemblywoman. Page 20 is our State Emergency Fund Assistance Program. This was a fund that was created by our former colleague, Assemblyman Fuentes, a few years ago, just to create the infrastructure for it. Governor has no proposal on this, and then the Senate and the Assembly each provided some general fund funding. Mr. Woolsey?
The difference between the two budgets is $500,000. The Association of Food Banks in California reports that this is equivalent to roughly 2.5 million meals that could be provided. So it's just a question for the legislature of what level of funding to provide.
And so again, just to clarify, different from our CalFresh program, which is federally funded assistance for purchasing of food. This is funding that we would provide if we were to move forward with this to our food banks.
That's correct. The CalFresh program provides funding for eligible individuals on an EBT card, which can be used like a debit card at grocery stores to purchase qualified food items. In contrast, the State Emergency Food Assistance Program allows for the purchase of California-produced foods, which are then distributed to the network of food banks, which then distribute them to eligible individuals at that location.
Thank you. So the good news is the difference between the two houses, just $500,000.
Yes.
So I would just note that we have put $47.3 million general fund into the drought assistance food program, which is really an emergency food program, and is being run very similarly to the state emergency food assistance program that does on an every year does have $10 million federal funds that is held back for this emergency food assistance program, so that gaps in need can be met with that food. But yeah, the $47.3 million general fund is specifically being provided directly to drought-assisted, the most drought-impacted counties, Tulare County, Kern County, many of the counties in the valley that are the most impacted by the drought. So we do not support an additional augmentation to the state's emergency food assistance program at this time because there has already been action really taken to address the most the most pressing needs of this year. Obviously, these things can change from year to year, but right now, the food that's being provided related to the impacts of the drought.
How many of our counties qualify for the $47 million?
24 counties.
24. So I don't know that anyone's making the argument that short of the drought, there's no need for additional assistance for folks who are struggling through the tough times of the economy.
And there has been 10 million federal funds ongoing that's available for the entire state.
And Mr. Woolsey, do we know from any communications you've had with food banks kind of unmet need they may be experiencing right now?
Our understanding from talking to the food banks is that they do feel that they have unmet needs and that they could easily distribute the foods that could be purchased with the funding proposed in either the Assembly or the Senate packages.
Thank you. Assemblyman Bloom.
Thank you. In my conversations with food banks, I just want to point out that the drought is impacting communities across the state. And I certainly think it's meaningful that we've been able to provide additional funding for those that are currently, communities that are currently identified as drought impacted. But the reality is the effects of the drought are being felt in all communities today, and particularly at the food bank level, because the cost of vegetables that are grown here in California is going up, and vegetables are becoming more scarce as a result of the drought. And this has a direct impact on their ability to provide in the local communities. So I think this is an important issue that we need to be following a little bit more closely.
Thank you, Assemblyman.
And I just wanted to correct, so it's actually 29 counties that the drought food assistance going to, was 24 counties that was expanded in the drought package earlier this year.
So half our counties, half are not. Page 21, federal immigration reform caseload impact.
So this was, we discussed this earlier today during the Medi-Cal budget, and this is the other portion of the assumption that there will be an action at the federal level to provide more individuals that are currently undocumented paths to become people residing under the color of law or PRU-call status. So that status does qualify individuals for the cash assistance program for immigrants, but there are also potentially other costs in CalWORKS, CalFresh, and IHSS for those families, and there are additional costs built in related to those programs as well. Those programs are not specifically for immigrants that are in the PRU-call category, but what happens is that once the family comes in for the cash assistance program for immigrants, they may also find out that their children who are citizens may qualify for other programs.
And LAO, your take on the governor's estimates?
Yes, Mr. Chair, members, Mark Newton with the LAO. We would recommend you're taking a conforming action with your action this morning to adopt at least through the Assembly action, which we believe appropriately reflects there being a longer phase-in period for the affected population than the administration assumes. We note, though, that since the Assembly adopted its action, we have provided sort of updated caseload impact estimates to staff, and we think you could up the Assembly savings by about $9 million.
By conforming to our earlier action?
By taking the Assembly savings, which is 17.7, and adding sort of an additional sort of $9 million due to just to sort of conform the phase-in periods between Medi-Cal and these programs.
Okay. I think so. Okay. Yep. Page 22 is the May revision local assistance estimates.
This is really just our May revision local assistance estimate, 84.4 in general fund for different caseload adjustments in the May revision. The Assembly amended the governor's estimate to adopt lower projections for CalWORKs employment services and child care programs. We are not comfortable going with those lower levels. We don't want to assume that these important services will not be provided in the budget year, and would want to make sure the money is built in up front to make sure that there's enough money set aside to provide those services throughout the budget year.
And Mr. Newton, how did the LAO reach its determination of modest overstatement of the CalWORKs employment services? Okay, Mr. Wilsey.
Hello again, Mr. Chair and members. When we receive the May revision estimates from the administration, we carefully look at them to determine whether, based on the most recent actuals, we believe the estimates are reasonable. And in general, we do defer to the administration on their estimates. But in this case, we do believe that while there is always some level of uncertainty in caseload estimates, we do believe that the administration's May revision caseload estimates are modestly overstated. This is a small reduction relative to what is a multi-billion-dollar allocation. And we view this as a conservative estimate of what the legislature could choose to reduce this allocation without reducing funding on a per-case basis. And so we would recommend the Assembly's action.
And the Assembly's action was based on your estimates?
Yes, although I would note that similar to the immigration item, we have since refined our estimates somewhat and believe that the best number to go with would be roughly $28 million, so slightly less than the original Assembly action.
And you've made your revision in numbers as a result of the delay in the court case?
This particular item is not directly related to legal proceedings related to the executive action. Our update to our caseload estimates in this case reflect some discussions that we had with the Department of Social Services. They brought up an issue that we had not considered, and in recognition of that issue, we reduced our expected savings somewhat.
And what was that issue?
The issue had to do with the implementation of early engagement, which we discussed in a previous item. It is possible that the implementation of the online CalWORKs assessment tool could marginally increase the number of children that are served in Stage 1 child care. We still believe there will likely be savings relative to the May revision, but we reduced that level of savings based on that information.
Very good. Thank you. Page 23 has to do with temporary assistance to needy families and the transfer to Student Aid Commission.
This is just a conforming issue, and it will reflect at the end of the day what the final actions are on the CalWORKs program. It's just the way we spend our TANF money.
So until we figure that out, we'll be keeping this open. And then our last page today in Human Services will be our CalFresh certification period.
So this was not an issue we had any proposal on. The Assembly adopted legislative intent language that specifies that all CalFresh households must be assigned certification periods that are the maximum number of months allowable under federal law. And I will turn that over to Jay to further explain what exactly that means.
So the federal government has eliminated change reporting, and the budget does assume some modest savings from that. I think this was more language that was considered or advocates had requested. We don't think it's necessary. The department was going to implement as intended here, but you know, it doesn't do any harm either.
Yes, Assemblywoman.
Yes, we've recently had some additional things coming up from our advocates, I guess, and so we're going to hold this over as we look at it. Federal law allows states that are facing high unemployment to list a restriction on the number of months every 3 years for an able-bodied adult without dependents at what do we call it, ABA, what do you call it, ABOB? ABOB can receive benefits. And counties historically have been allowed to, the ability to opt out of this more generous exemption, but seldom have. Advocates are proposing to remove the county ability to opt out, allowing California to take advantage of this exemption of the ABOBs. It is estimated that 340,000 ABOBs in California would benefit from this exemption. So this is obviously an item of concern that we want to look at when it comes to our CalFresh population and certification. So we're going to hold this item over and look into this, make sure we're doing the right thing. Okay?
Very good. I think this is also very similar to a portion of a Senator Hertzberg bill.
Right, exactly.
So, colleagues, we have completed our first reading of Human Services. Sorry. Yes. All right. So we're going to conclude our work for the day. Senators have to get back to the floor to complete our voting, and I know you have to do your reconciliation. And then our schedule for tomorrow will start at 11 and go until 4 p.m. K through 12. All right. Thank you, colleagues. And that's it for today.